Welcome to our MRI suite. MRI, magnetic resonance imaging, is a powerful diagnostic tool that helps us look inside the body, but it also requires strict safety measures to ensure the safety of both patients and staff. In this video, we will go over the different zones in the MRI suite, the safety precautions that must be followed, and what to do in case of an emergency. The 4 zones of the MRI suite. Zone 1, the waiting area. This is the space you can occupy without any supervision. It's where patients and visitors can wait before their MRI procedure. It's a safe zone with no immediate concerns about the magnetic field of the MRI machine. Zone 2, the screening area. This is where patients and visitors are questioned about their medical history and possible risks related to the MRI. Before anyone can move past Zone 2, we need to ensure that they are safe to enter the MRI suite. This is where the screening form is filled out, and any metal objects or surgical implants must be disclosed. Zone 3, the technologist work area. This is the area where MRI technologists operate the MRI machine. If you need to be in this area, you must be directly supervised by an MRI technologist at all times. Remember, safety is our priority, and there is always supervision here. Zone 4, the magnet room. This is the most critical and sensitive area of the MRI suite, where the MRI machine is located. Anyone entering Zone 4 must be screened and must be accompanied by an MRI technologist. No exceptions. The magnet inside is extremely powerful, and it's crucial that only authorized and screened individuals enter Zone 4. Why MRI safety is so important? The MRI magnet is always on, and it generates a very strong magnetic field. Because of this, we must be extremely careful. Items like oxygen tanks, IV poles, and even floor buffing machines cannot enter the MRI room. These items can get stuck to the magnet, potentially causing serious damage and safety risks. Consequences of forgetting to remove objects. One of the most common accidents happens when patients forget to remove items like wallets from their pockets before entering the scanner room. If your wallet has magnetic strips, such as those on credit cards, they can be erased and the information will be lost. Medical implants. It's very important to be aware of medical implants like pacemakers, neurostimulators, coils, and stents. Modern MRI scanners allow certain MRI conditional implants to be scanned under specific conditions. This means that some devices can go into the magnet room, but only under very controlled circumstances, after a detailed screening and evaluation by the MRI technologist. The technologist will carefully investigate the conditions under which the implant can be safely scanned. Even if you've filled out an MRI safety screening form prior, it's crucial that you fill it out again if you return for another MRI session. Your surgical history may have changed, or you may have acquired new implants or metal objects since your last visit. In the event of an emergency, here's the protocol we follow. The MRI technologist removes the patient from the MRI scanner immediately. The technologist then locks the magnet room behind them. Finally, they call a code or rapid response by dialing 1111. What is an MRI quench? An MRI quench occurs when the magnet loses its magnetic field. This happens when the liquid helium used to cool the magnet turns into gas and escapes quickly into the air. A quench can occur accidentally due to equipment malfunction, or it may be intentionally initiated during an emergency, such as when a patient is injured or trapped near the magnet. During a quench, everyone must evacuate the MRI suite immediately to avoid risks such as suffocation or frostbite from the escaping gas. It's important to emphasize that the MRI magnet is always on. The badge access to the MRI area, including the magnet room, is for the safety of both our patients and staff. The magnet's power is immense, and without strict safety measures, there's a potential for harm. Conclusion: MRI safety is everyone's responsibility. By following these guidelines and taking proper precautions, we can ensure that the MRI suite remains a safe environment for both patients and staff. If you have any questions, always feel free to ask the MRI technologist or any of our staff. Stay safe, and thank you for helping us maintain a safe MRI environment.